What do you do when you lose hundreds of pounds, but your body still feels like a prison? Loose skin is just one of those things that you cannot really avoid if you lose a lot of weight, yet so many people are afraid of it, and nobody really talks about what the options are after you've lost weight because they can be really taboo. And recently, one of the bigger social media fat loss accounts, Jesse or Progressive Overhaul, actually went for a pretty invasive surgery. So Jesse is one of the first people that I started talking to during my entire weight loss journey. And it just so happened that he was in the middle of his too. Starting at much over 500 pounds, he was a big boy to begin with. And to be able to get his surgery, he had to hit 260 pounds, meaning that he was over 250 pounds down by the time he actually got on the table. Every single week, he does a weekly update of his weight, cracking some joke at some comments.
Week 38 of cutting every week until I no longer look like the shapeless version of the Michelin Man.
Talks about how he was this fat and now he's slightly less fat.
Last week I was this fat, this week I'm this slightly less fat.
And then he'll do his physique checks to check how his journey is going.
And y'all keep telling me I have one, so we'll do a quick physique check.
He always does these dances. I don't know where he got these from. I don't think he does either. But he enjoys it, and the internet really seems to enjoy it too, during his
loose skin check.
As you can see, there's a bit of loose skin. Now, the reason why Jesse is so successful online is because of his incredible positivity, but also because he's very real when he talks about all of his struggles and, well, his path along weight loss. So the surgery that Jesse had was a fleur de lis with a circumferential body lift and chest skin excision and nipple graft. To put these into simpler words, fleur de lis is the incision that goes from down at the pubis area all the way up the sternum. And this is how they grab and then they wrap everything together to tighten everything up. Alongside this, he got the circumferential body lift, which means that this was an incision that went all the way across his entire torso. What they do here is they can remove large chunks of skin. They grab the skin from here, they grab the skin from here, and they tie it all together. So now that you have this tighten up and this tighten up, this entire region gets very tight. But he also had a lot of loose skin on his chest, and as do I. You can see it better when I bend over, it sucks. And that's this scar that he has here, where they grab the skin here, they grab the skin here, they pull it in together, and the nipple graft is because they actually cut out the nipple completely, got the skin together, and then replaced the nipple in place wherever it's supposed to go. And now it's time to look at the results. So as you can see previously, he obviously has a lot of loose skin under his chest. The torso, the bottom torso, belly button area is riddled with loose skin. This is an example of someone who just didn't have the best genetics, but did the work and lost the weight. And when Jesse first sent me the results picture, I was in bed, and you know when you're in bed and you're just kind of scrolling like this? When I saw those results, I dropped my phone on my face because I was so struck by these results. Look at this comparison.
Walking on a dream. Something about you beautiful.
That is absolutely insane. Obviously, I had to call Jesse and I had a couple questions for him. Going into the surgery at first, were you super nervous about it?
The nerve level was quite high. The anxiety level was quite high. I was very confident in my surgeon choice, so I wasn't like scared per se of like dying or something up to the to an extreme extent. But I was certainly nervous for the recovery aspect, and you talk to so many people that have gone through these surgeries, and you hear so many different stories. Everybody has their own opinion. Everybody goes into these with a different level of strength or different level of pain tolerance or whatever. And some people will say it's like the worst thing that they'd ever gone through, that they immediately regretted it for a long time and it took them forever before they start to feel good about it, all those sorts of things. So yeah, I kind of had everybody else's voice in my head telling me their experience rather than me kind of trying to figure out how I felt. Like 2 of my painkillers are ibuprofen and Tylenol, and then I'm taking gabapentin. So gabapentin, ibuprofen, Tylenol.
I mean, the results. How do you feel about the results?
So, I had like an expectation, and my expectation was not that it was going to be as good as it is. Honestly, I went into it almost expecting that I would still have a little bit of loose skin, for the rest of my life, just because of the fact that
Yeah.
I didn't go into this as lean as some people do. But for me, it was never about being that guy that's like, I don't ever plan to step on a bodybuilding stage. I just want to be fit and healthy the rest of my life.
So obviously you have 2 other surgeries, I believe, your legs and then your arms.
Legs and arms are one more stage. So when I only have one more surgery, it'll be my legs and my arms together, and then there's still like a little flap of fat of roll, we'll call it, in like my upper back that we'll get at the same time we do my arms.
Right, makes sense. Okay. This one is a little bit more of a deep dive question, more of a very authentic question, which is a little bit almost scary to answer, because I've been thinking about asking you this for a while now. I just didn't really know how to say it, so I'm just gonna fucking blast it and we'll see what happens. Do you think that your social media following will hurt without the loose skin?
I don't think that it will hurt my following, although it might hurt my ability to grow a little bit. And that's just because I think that the loose skin almost gives me like a shock factor. Like when somebody's scrolling on social media, this shock factor of seeing the skin would make them stop.
Of course.
And give me that few extra seconds for me to hook them into my content and make them enjoy what I'm saying or doing or whatever, right? So I think in a way it may hurt my ability to keep growing, but certainly to me it's a community. I do my best to engage with every comment, to reply to as many DMs as I can. I'm as involved with my social media as I can be, because I want people to feel heard, I want people to feel seen, and I want them to feel valued.
And then to get a full picture of the surgery and his opinions on what it's like operating on men who have lost a significant amount of weight, I wanted to get a hold of his doctor as well, Dr. G. And I managed to do that. So how long exactly was Jesse's surgery?
So Jesse's surgery was about 6.5 hours. And I told him, I think I told him 5 hours. So I went a little bit over my estimate. But this is another thing about surgery. When I eyeball you, when I'm examining you, it is just an estimate, because there's so many variables that can happen in the surgery. I'll give you a couple. The lipo sometimes can be more difficult due to fibrosis or individual anatomy. Lipo, for everyone, is that when we suck out the fat. That's how I create a little bit of shape. It can be very easy. The fat can flow like lava. And I'm like, yes, this is vet. Or it can be more difficult. Men tend to have more difficult liposuction. And for people at home, I'll give you the answer why. Because men tend to have more subcutaneous fat and less deep fat, whereas women tend to have less subcutaneous fat and more deep fat, which makes liposuction way easier on women. The second factor is bleeding. And this is, we'll kind of cover danger of weight loss surgery. This is such an interesting fact. So when you get bigger, when you put on a lot of weight, everyone can see that you get more skin and you get more fat, right? It's obvious. When you lose weight, you lose the fat, but the skin just sags, right? You're with me. This is very clear. Guess what happens with blood vessels? It is so interesting. Yeah, no one thinks about this, but as a surgeon, this is like, I have to think about this. When you are really big, those blood vessels turn into the I-95. They are like cables on a regular abdomen. Your blood vessels might be, 5 millimeters, 8 millimeters max. On a weight loss patient like Jesse, those blood vessels hypertrophy to like 2 centimeters. They look like anacondas in the tissues.
So you have to be careful when you're like liposuction.
You have to be careful. You have to be careful. And this is the thing. They don't shrink. So remember I told you when you're big and you lose weight, the fat shrinks, but the skin just hangs there. The blood vessels are the same. They go from mega big and feeding all that fat to just hanging mega big. The blood vessels do not shrink. So this is one major reason why you have to kind of be a little bit more cautious with weight loss patients. You can't do head to toe, because imagine just 1 or 2 of those blood vessels is difficult to control. You're in a life-threatening situation, right? Did you know that about the blood vessels?
I didn't, and that actually
Isn't it interesting?
that was the surgery like textbook, or was there complications? Was there things that you ran into that you weren't expecting?
No, so I think every surgery has an element of surprise because it's every body is different. I think that everything went perfectly well. There was no complications. Complications can happen. You know, bleeding can be out of control. Sometimes patients have to go to the hospital if they can't pee. Like there can be simple things like that. Like, but none of those happened. He did really well.
So, if you had any word to the people, like any piece of advice to anybody that is obviously like facing this decision, what would?
I guess my advice is you're worth it, and I think don't do this surgery for anyone but yourself. And if you're not ready or you're happy in your skin, then do you. There's nothing wrong with you. You are worth it. You are good enough just the way you are. But, and I think this is the big one. If that skin bugs you in any way, you can get rid of it. And don't let anyone tell you otherwise.
So, yes, you can get the surgery, but I think that even if you do get the surgery, there's still a mental aspect that you're still going to have to fight regardless of if you have your loose skin or not. It's the fact that you have been damaging your body for a number of years to get as obese as you did or are currently. And that when you do lose the weight, there are some mental battles you're going to have to face, and loose skin is just one of them. Now, yes, surgery will fix you aesthetically, and it'll make you feel, especially when you're wearing clothing, that like you are part of normal society and that you never essentially were that previous version of you, but it doesn't change the fact that you were and or are. So it's very important to realize this, and that when you do get your surgery, it's not the end of your journey, it's just another step towards a better lifestyle, which will never end. So when it comes to anything online, anything you see on social media, or even a friend that is currently losing weight or has lost weight, I think it's always important to celebrate people that are fighting the battles that you'll never see. But let me know in the comments, is weight loss surgery something that you have thought about doing? I'm getting my chest done in 2 weeks from now. And not that I'm nervous, but I'm starting to get very excited about what my chest is gonna look like without gyno and without all of my little flabby skin that I have here. So is this something that you've thought about, or is loose skin something that's actually held you back from losing weight?